Why did Hallmark Health System pursue the bedside handoff model?
Well, we decided to really take a look at patient safety, and we found that there was a lapse in the transfer of information which could have affected the patient care. So we decided to put all the players together and bring in all the clinicians and nurses and physicians and PAs. And the decision by that group was that the best place to transfer information was at the bedside and in person. We were using technology, and people were not communicating. And we found that actually, even though we moved to that years ago, that it really was detrimental to the transfer of care and for the safety of the patient. People just needed to talk to each other. And the best place was at the patient's side, because we also wanted to involve the patient to make sure that the patient knew what was going on.
And what have the results been to date?
So far, pretty good. I mean, it's been a little change in process for everyone's workload because it's counterintuitive to the way technology works. But in terms of the patient care, we found that there are many fewer instances where information has not been transferred or situations have not been identified. Patients are going upstairs where the care plan is in place, people understand, and the biggest thing is that we found is, as part of a patient safety goal, is the clinicians accepting care for the patient, which are essentially the nurses upstairs, have the opportunity to ask questions. So if they have any questions about the care of the patient, then they're able to ask them and get their answers at that time, so both they and the patient understand the process.
Are other improvements being made going forward?
Oh, sure. We're really trying to fine-tune the process so it's the same every time. We're trying to standardize it. I mean, everyone has a different level of expertise and understanding of what should happen, but we feel the best way to ensure that the correct information is being transferred for the patient's safety is to standardize it, and that's our next process, is to standardize that process. So every person that gets admitted through the emergency department is handled exactly the same way, and the transfer of information with the care plan is handled exactly the same way every single time.